Listen up, people, because the government just dropped a number that affects nearly 75 million Americans. And frankly, it's a slap in the face for retirees across this country. The Social Security Administration finally announced the cost of living adjustment, the COLA, for next year, 2026. And the number is 2.8%. That means if you are getting Social Security, your check is going up by 2.8% starting in January. This bump also hits millions of other Americans, like people on supplemental security income, military retirees, disabled veterans, and most federal retirees. We're talking about a massive chunk of our population relying on this money just to stay afloat. For the average retired worker, this tiny increase translates to roughly $56 extra every month. $56. Think about that for a second. $56 a month. That is $672 for the entire year. Now, before you go thinking, hey, 56 bucks is 56 bucks, let me hit you with the harsh reality that senior citizen advocates are screaming about right now. This raise is not enough. It is already inadequate, and here is why. Just look at the numbers from the last few years. We had the huge COLA of 8% back in 2023 when inflation was spiking. That felt like a raise. Then it dropped to a 3% bump in 2024, and this year it was only 2.5%. Now we're at 2.8%, which is slightly better than this year, but still less than the average COLA over the last 10 years, which was more than 3%. The government calculates that overall, prices went up by 3% over the past year. Your 2.8% COLA is already falling short of basic price increases. You are already losing ground the second this raise hits your bank account. And here is the brutal part, the part that wipes out that measly $56 increase: Medicare. If you are a senior on Social Security, your Medicare Part B premium usually gets yanked right out of your Social Security check before you ever see the money. And guess what? Medicare Part B premiums are projected to jump by almost 12% next year. We're talking about an increase of roughly $21.50 per month. So take your $56 average raise, subtract the projected $21.50 increase for Medicare, and what are you left with? About $34.50. That $34.50 net increase is supposed to cover rising costs for food, housing, and healthcare. That is a joke. Financial experts are calling this exactly what it is: a massive financial squeeze. This isn't just theory. People are feeling the pain right now. Polls show that nearly 80% of Americans age 50 and older flat out disagree that a COLA around 3% is enough to keep up with rising costs. They say they need a 5% increase or higher just to break even. Why is this happening? Why is the official government raise always falling short? It all comes down to a super technical term called the CPI-W. That stands for the Consumer Price Index for urban wage earners and clerical workers. This is the official calculation the government uses to decide your COLA. The CPI-W measures the price changes for workers who are generally under the age of 62. These people spend money differently than retirees. For people retired from the workforce, major expenses are things like medical care, prescriptions, and housing. Advocates for older Americans argue that the government should be using the CPI-E, which is the Consumer Price Index for the elderly. This calculation puts heavier weight on the things seniors actually buy, like healthcare, which is always rising faster than overall inflation. Experts say that if the government used the CPI-E, seniors would see a better adjustment more than 69% of the time. The current calculation system is literally designed to underestimate how much older Americans are suffering from inflation. Senior advocacy groups are fighting Congress, asking them to switch to the CPI-E and establish a minimum COLA of 3% every year. Because right now, nearly 1 out of every 10 retirement-age Americans is living in poverty, and some experts think the real number is even higher. The COLA announcement itself was a mess this year. It was supposed to drop on October 15th, but the ongoing government shutdown delayed the release of the key inflation data needed to calculate the raise. The government literally had to recall furloughed workers just to finish the report and announce your 2.8% raise. Now, let's talk about some other big money changes that kick in next year. These changes mostly hit the people still working and paying into the system. First, the maximum taxable wage cap is jumping up. This cap is the limit on how much of your income is subject to the Social Security payroll tax. For 2026, that cap is increasing from $176,100 to $184,500. If you are a high earner, earning more than $184,500, this means you will be paying thousands of dollars more into Social Security next year. The tax rate itself, 6.2% for you and 6.2% for your employer, is not changing, but the amount of income it applies to is going up by about $8,400. This change happens because it's based on national wage growth, not consumer prices, but it definitely hits high earners harder. Second, if you are a worker who hasn't hit your full retirement age yet, but you are collecting benefits, you need to watch your income. They use something called the earnings test. If you earn too much, they reduce your Social Security benefits. For 2026, if you claim early, they will withhold $1 of benefits for every $2 you earn above $24,480 per year. Finally, let's address the massive elephant in the room: Social Security's solvency. The Social Security system is mostly funded by those payroll taxes we just talked about. But here's the terrifying truth: the retirement trust fund is expected to be depleted in about 7 years, around 2034. If Congress doesn't act and fix this mess before then, all benefits could be automatically cut by as much as 20%. We're getting these measly cost of living adjustments while the whole system is heading toward a cliff. This entire financial situation, the small raise, the huge Medicare deduction, and the fear of the fund running out is exactly why every American needs to take their retirement planning into their own hands. You cannot rely on the government to keep you financially secure. If you are approaching retirement, remember you can boost your checks substantially by waiting to claim. You can claim as early as 62, but that means a permanent reduction in your payment. If your full retirement age is 67 and you claim at 62, your check is cut by 30%. If you wait until 70, your monthly benefit can be 28% higher than if you claimed at full retirement age. Use retirement savings like IRAs or 401ks to build a bridge and delay taking Social Security as long as possible. The bottom line is simple: 2.8% is not a raise. It's barely survival money. You need to plan your retirement finances for the cost you are actually facing today, not for the government's lowballed estimate. Thank you for tuning in. If you found this information useful, hit that like button. Make sure you subscribe so you don't miss our next video, and ring the bell so you get notified every time we drop some financial truth bombs. I appreciate you spending your time with me. I'll catch you next time.